It's better. It's liver is the largest gland in the body, right? Liver is the largest gland in the body. Just we, it is the after the skin. It's the largest single organ. Right? It's the largest single organ that weighs about 1,500 grams on average. And it's going to make about 2.5% of the adult body weight. Okay. For the liver, there is a Greek word hepar, right? There's a Greek word hepar that is called as a liver. And that's why we use an adjective hepatic to describe different terms, conditions, or the structures related with the liver, right? So whenever we talk about any thing which is related with the liver, we are going to use the hepatic as an adjective. And that adjective has been derived from the word hepar, that means a liver in the Greek language. Well, this is a soft and pliable tissue, right? And its color is, you can see, it's reddish brown in color. And its shape is just like a wedge. You think it's triangle, a wedge-shaped structure, right? What is location then? It is located you can see that it is located in the right upper quadrant of the body. Okay, it is going to extend from the right hypogonium through the epigastrium up to the some part of the left hypogonium, right? So it is going to occupy the three regions: the right hypogonium, epigastrium, and some part of the left hypogonium, right? But here you can see the most of the content of the liver, it lies here in the right, under the cover of the right costal margin. The right costal margin. So most of the liver is located in the right costal margin between 7 to 11 ribs, right? Under the right hemidiaphragm. You see? Hemidiaphragm, what do you mean by hemidiaphragm?
Yes, sir.
Hemidiaphragm क्या होता है जी? Means the half of the diaphragm of the right side, right? The diaphragm or the right side of the and then from here is going to extend up to the left hemidiaphragm. And you can see this hemidiaphragm, but it is going to separate the liver from the right lung and the pleura, right? And here you can see pericardium and the heart, right? Your problem to image. And then in the region of the epigastrium, here it lies in direct contact with the anterior abdominal wall, right? Is it clear, Ji? So as far as our location is concerned, then it's going to occupy most of the area of the right head, right costal margin. When you take this deep breath, right, then the liver is pushed downwards, right? With the, as you know, when you take the deep breath, the lung will expand and it's going to push the liver down. You can feel this anterior border of the liver under the right costal margin. In this case, we ask the patient to lie in the supine position with his, flexed thighs. Then we are going to ask him to take a deep breath. And when the patient takes a deep breath, then we'll ask him to hold the breath. Then. We can feel this anterior border of the liver under the right costal margin, right? Now, as far as the liver is concerned, have a look over it. Then it has got the two surfaces. One is this anterior superior surface that is called as the diaphragmatic surface also. Other one is the posterior inferior surface that is called as a visceral surface. Okay? So it has got two surfaces, the diaphragmatic surface that is called as the anterior superior surface also. And the other one is the posterior inferior surface or the visceral surface. Now, the diaphragmatic surface, it is smooth and convex. Because you see, it's a dome-shaped convex surface. And it's smooth, right? And it is this surface, convex surface, the dome of the convex surface It is lying in the concavity of the diaphragm. ये आप देख सकते हैं, ठीक है, ये this is a diaphragm has been separated. So this dome shaped surface of the liver, it is lying in contact with the diaphragm. It lies in the concavity of the diaphragm. And you guys, I told you before, this diaphragm is going to separate it above from the क्या था जी, right side पे, the right lung and the pleura, and here this is the region where it is going to separate the, for the pericardium and the heart, right? Sorry. You see, between this diaphragm and this dome-shaped surface of liver, this is a recess, this is space, and this is called as the anterior subphrenic space. Take it, anterior, of course, lying anteriorly. Subphrenic means below the diaphragm, right? This anterior subphrenic space, right? And this space, it is going to divide by this ligament that is called the falciform ligament into the right anterior subphrenic space and the left anterior subphrenic space. यहाँ तो बात clear है जी? Everything is clear now? Now, have a look over this anterior border of the liver, right? It is sharp. It extends from the right ninth costal cartilage to the left eighth costal cartilage, right? And it is going to separate this anterior superior surface from the posterior inferior surface. Here you can see this one. This is a sharp border, right? And this sharp border, it is going to separate the anterior superior surface or the diaphragmatic surface from the posterior inferior or the visceral surface, right? And this border, this anterior border over here, you can see it is going to show the two notches in its way. First one over here, that is called as a notch for the fundus of the gallbladder, and this one is a notch for the ligamentum teres. You can see this is this rounded, structure lying over here, and this is the ligamentum teres. Okay, we'll talk about this, ligamentum teres in a while. So falciform ligament, which free border hai, in this border, there's a round ligament present that is called as a ligamentum teres. So the anterior border of the liver, which is going to separate the anterior superior surface of the diaphragmatic surface from the posterior inferior of the visceral surface, and number two, it is going to present the two notches in its way, one for the fundus of the gallbladder and other for the ligamentum teres. यहाँ तक problem तो नहीं है बच्चे. Okay, if you have a look over the surface, posterior inferior surface of the visceral surface, you see it is irregular. ये तो थी ना smooth, right? Smooth and convex dome shaped. So here you can see this surface, it is irregular. And it is irregular why? Because there is a multiple fissures. You can see these, longitudinal depressions in this region, right? And horizontal in this region. So multiple fissures and the different impressions, right? These impressions, right? So these multiple fissures and these impressions give it a irregular appearance because this surface, it lies over the different viscera. So it is molded to the adjacent viscera. Is it clear? So from the left to right, you can see these depressions on the, we start from this left lobe. Here you can see this is a depression, rather the impression for the esophagus, and this after esophagus you can see a large impression over here, and this is the impression for the stomach. Okay, so this surface, the left lobe, it is going to be related with the two structures like the esophagus and this larger impression for the stomach. After that, we have got this impression. This is a duodenal impression over here on the right side. First of all, you can see in the right lobe over here, you see this is the lobe of the liver that is called as the quadrate of the liver. And this part, it is going to be, in relation with the pylorus of the stomach, right? And then this is a depression. Here you can see the gallbladder in this position, right? And after the gallbladder, this is here, this impression. just right to the gallbladder, there's an impression for the jejunum, right? And then this hanging part, right sided or lower hanging part, that is having the impression of the hepatic flexure, right? Okay, and after this, we have this impression, which is kidney shape. This is a renal impression. ठीक है जी, and उसके बाद you can see this impression, a similar impression, and that is for the sorry, suprarenal, right, suprarenal gland, right? And here you can see the inferior vena cava in its position. So there's a depression for the inferior vena cava. So which is this surface, in short, the visual surface, it has got these impressions due to the presence, the relation of the, in this posterior inferior surface of the liver to different organs. Is it clear? Okay. Other than these impressions, I have told you before that the two sagittally oriented fissures are there, right? These fissures means grooves, right? So you can see these two grooves, one between the right and the left lobe over here, and the other one is over here in the line, which is marked by the presence of the gallbladder and the inferior vena cava anterior posteriorly, right? And then in between these two fissures, there is another transverse or the horizontal fissure over here, and this is called as the porta hepatis. So these three fissures, they are going to give it, the shape of the H, right? Okay, H-shaped fissure, you can see it is present on the posterior inferior surface. Okay. Now, here you can see that on the right side, this fissure in where the gallbladder and the inferior vena lies, this longitudinal fissure, right? This is called as the right sagittal fissure. Okay, ji? The right side पे, this is called as the right sagittal fissure, and it is marked anteriorly by the groove for the gallbladder and posteriorly for the groove for the inferior vena. ठीक है जी? Problem तो नहीं है बच्चे यहाँ तक, right? So the right sagittal fissure, it is a continuous groove, right? It is found anteriorly by the groove for the gallbladder and posteriorly by the groove for the inferior vena cava. ठीक है जी? उसके बाद we have got the another fissure on the left side, which is just going to separate this right lobe from the left lobe, right? This is called the left sagittal fissure. Sorry, and it is also called as the umbilical fissure. ठीक है जी? Left sagittal fissure, and it is also called as the umbilical fissure. And it is also, you can see this in a continuous groove, which is found anteriorly by the, as I have told you before, this structure that is called the ligamentum teres, which is present in the free edge of the falciform ligament, right? And this ligamentum teres is basically the fibrous remnant of the left umbilical vein that carries the oxygenated blood and the nutrient-rich blood from the placenta to the fetus, right? So after the birth, you see it's just going to be occluded and present in the form of the ligament, or that called as the round ligament or the ligamentum teres, right? So this left sagittal fissure, interiorly, it is going to have this fissure for the ligamentum teres, right? And posteriorly, this fissure is going to be continuous with the fissure for the ligamentum venosum. So this, umbilical or the left sagittal fissure, it is basically bearing the two fissures anteriorly and posteriorly, and both of these fissures, they are having the, relation with the fetal remnant. Anterior one, that is for fissure for the ligamentum teres, okay, which is the fibrous remnant of the left umbilical vein, whereas the posterior fissure, it is related to the ligamentum venosum. This is the fissure for the ligamentum venosum. Ligamentum venosum is also the fibrous remnant of the fetal ductus venosus. And ductus venosus is function that it is just going to shunt the deoxygenated blood from the umbilical vein to the inferior vein, right, by passing the liver. So the left sagittal fissure or the umbilical fissure, anterior posteriorly, it is also related to the anterior to the ligamentum teres, fissure for the ligament teres, and the posterior of the ligamentum minimum. यहाँ तक बात clear है जी, कोई problem तो नहीं है? Okay, sorry. Now you can see these two, horizontal fissures. They are, joined in the midline by this deep transverse fissure. And this deep transverse fissure is about 5 centimeters long. It is called as the porta hepatis. ठीक है जी? ये एक horizontal fissure है जो कि इन दोनों vertical fissures के दरमियान में है, right? And it is called as the porta hepatis, and it is equivalent. It is called as the hilum of the liver. Hilum क्या होता है जी? Where the structures are entering or leaving the organ. ठीक है जी? So this horizontal fissure, it lies between the two lobes of the liver. This one, anterior one here, that is called the quadrate lobe of the liver, and this small one, this is called the caudate lobe of the liver. ठीक है जी? So it lies between the quadrate lobe of the liver and the caudate lobe of the liver, which are basically the parts of the right lobe of the liver. Anatomically, these are the parts of the right lobe of the liver. ठीक है? Is it clear जी? And
Yes.
porta hepatis हमने कहाँ पढ़ा था जी? किसी को याद है? When we talked about the attachment of the lesser mentum, मैंने बताया था ना, inverted L-shaped attachment होती है जी, जिसकी vertical limb is going to be attached with the fissure for the ligamentum minimum. ये आप देख सकते हैं, ये this is the attachment of the lesser mentum आपको नजर आ रही है, ठीक है? So क्या था जी? Vertical limb is attached along the fissure for the ligamentum minimum, and the horizontal limb is going to be attached to the margins of the porta hepatis. ठीक है जी? So it is going to give attachment to the lesser mentum, to its margins. Well, it is going to contain the structures, those structures which are just going to enter the liver or coming out of the liver. जो structure enter हो रहा होगा कौन कौन से होंगे जी? Of course, the hepatic artery, which is going to divide into the branches right and the left hepatic artery. ठीक है जी? Then portal vein is getting enter into it, again dividing into two branches. Then with the arteries, I told you, there is sympathetic and parasympathetic nerves coming from the celiac plexus. They are going to enter in. ठीक है जी? उसके अलावा the structure, the bile ducts, hepatic ducts, right, which are bringing the bile from the liver into this gallbladder. ठीक है? ये structure they are bringing the out. And certain lymphatics will be there, which are just going to enter in this region. In this region में आपको यहाँ पे lymph nodes भी मिलते हैं. These are called as the hepatic lymph nodes. Of course, मैंने आपको बताया था ना, hepatic artery के साथ उसके lymph nodes भी पड़े होंगे, right? So hepatic lymph nodes, and of course the lymphatics which are carrying the lymph from the liver into lymph nodes. These are also coming through this porta hepatis, right? And these three structures, especially the portal vein, hepatic artery, and the ducts, before backwards, they are arranged. So सबसे पहले usually coming across the hepatic ducts, then the hepatic artery, and then the portal vein from before backwards. ठीक है जी? Is it clear जी? Now we'll talk about the relations. Anteriorly आप liver के relations देखें बेटा, तो you will be coming across with the, तो ये देखें ना, dome of the diaphragm इसको cover कर रही है, because diaphragm is getting origin from the lower ribs. ठीक है? तो anteriorly इसको जो है diaphragm भी इसका रहा, and this diaphragm, it is going to separate it from the right lung and the pleural, right, on the right side, some part of it on the left side. Right? Then the in the middle area, this area, it is going to separate this pericardium and the heart. उसके बाद anteriorly you can see the right costal margin, right, and this left costal margin over here also. ठीक है जी? This one, and then this, you see the xiphoid process here, and the anterior abdominal wall, right, in the subcostal angles. ठीक है? ये दोनों costal angles के दरमियान में जो anterior abdominal wall का part है. So anteriorly, the liver has got the relations with the diaphragm, which is going to separate it from the pleury and the lung and the heart and the pericardium, and then the right costal margin, the left costal margin, and then this costal angle. Darmiyan mein, we have got this xiphoid process and also the anterior abdominal wall. Problem to nahi hai. In posterior relations mein, told you the posterior relations mein, the structures which are lying on its posterior, which are in contact with the posterior inferior surface of the lip. ठीक है, और सबसे पहले you can see एक तो lower part of diaphragm यहाँ से आ रहा है side से, right, and then we have got the, you see, the right kidney over here. उसके बाद यहाँ पे right suprarenal gland पड़ा हुआ था, right. This is an hepatic flexure. मैंने बताया था ना, chronic impression पड़ा हुआ है इसके right lobe के hanging part के ऊपर. Sorry. And again, you can see the gallbladder over here, and then the inferior vena cava was present in this region. ठीक है जी. और यहाँ पे लेफ्ट लोब के अगेंस्ट ये देखिए स्टमक और ऊपर से जो esophagus आ रही है, right. So all those structures which are we have talked about already, which are forming the posterior relations with or lying in the contact the posterior inferior surface, we have, and these structures, these are going to make the impression over this posterior inferior surface of the. Okay. Any problem till now? Okay. As far as the liver is concerned, the liver, it is being divided into the two lobes. The right lobe, the larger one, and the left lobe, the smaller one. And this function that is being carried out, this division is carried out by the presence of this falciform ligament. Falciform ligament, but it is basically a peritoneal attachment, right? Two-layered fold of the peritoneum, which is just going to attach the liver with the anterior abdominal wall. उसके free margin, I told you before, इसमें round ligament of the teres is running, right? So this ligament is going to divide the liver into the right larger lobe and the left smaller lobe. ठीक है जी? Sorry. So anteriorly, this division, it is marked by the presence of this falciform ligament. And on the posterior inferior surface, it is marked by the presence of this, ये क्या था जी? किसी को याद है? अभी मैंने सबसे पहले बताया, this is a left sagittal fissure. ठीक है, left sagittal fissure, right? Okay, anteriorly it is marked by the presence of this fissure for the ligamentum teres, and posteriorly marked by the presence of this fissure for the ligamentum venosus. Okay, we'll talk about the right lobe. So right lobe, you can see that is much more larger. About 5/6 of the liver is going to form the right lobe, and this smaller portion is going to form the left lobe. Okay, and it is going to, this surface, this larger surface, but both the surfaces, anterior superior and posterior inferior surface, and in its posterior inferior surface, it is going to present two lobes. These are called as the quadrate lobe. You see this quadrangular shaped part of the right lobe of the liver is called as the quadrate lobe, and this quadrate lobe lying between the ligament fissure for the ligamentum teres and the gallbladder, right? And the other one is the caudate lobe, C-A-U-D-A-T-E, caudate lobe. And that lobe, it lies between the, the fissure for the ligamentum venosum and the inferior vena cava. So these two lobes, sorry, these are the parts that are right, anatomically the parts of the right lobe of the liver. Okay. Okay, you have a look over this quadrate lobe of the liver. You can see this one, the quadrate lobe of the liver. Right? In this quadrate lobe of the liver, it is situated, you can see, there's on the posterior inferior surface, right? And it is bounded on the right side by the groove for the inferior vena cava, and it is left side is for, limited by the fissure for the ligamentum venosum, right? And inferiorly, it is limited by the presence of this porta hepatis. Right? Okay, now, and from here above, it is going to be continuous with the, diaphragmatic surface. Below to the, below and to the right, you can see, below and to the right, just behind the porta hepatis, right? Just behind the porta hepatis, it is going to be continuous with the right lobe of the liver. See, this is So this small extension, which is extending from just downwards into the right and just doing this portal apparatus, it is going to be continuous with the right lobe of the liver. And and below to the left here, you can see this rounded elevation. And this rounded elevation is called as the papillary process. So this caudate lobe, which is located between the inferior vena cava, between the inferior vena cava and the fissure for the ligamentum venosus, it is called as a downward extension to the right side, which is right side, no, which is going to contain the right lobe of the liver, and on the left side, downwards and to the left, it is going to present a small round elevation that is called as the papillary process. यहाँ तक बात clear है कि problem तो नहीं है इसमें. Then we have got the quadrate lobe of the liver. You can see the quadrate lobe that is quadrangular in shape, right? And it is you see this इसके ऊपर आपको ये एक impression सा नजर आ रहा है, right? So this quadrate lobe of the liver basically it is lying in relation to the pylorus of the stomach, right? I told you before. So it is situated on the posterior inferior surface. That is quadrangular or rectangular sort of a thing shape, and bounded anteriorly by the it is bounded anteriorly by the anterior border. So it is bounded anteriorly by the anterior border, right, and posteriorly by the porta hepatis, right, and on the right side the fissure for the gallbladder, and on the left side the fissure for the ligamentum teres, right. So this is about the caudate and the caudate lobe of the livers. Sorry. Now we go to the left lobe. Left lobe is, you can see, the smaller one. Okay, but as I told you before, that the caudate lobe, it is so the left lobe, it is lying against the esophagus and the its inferior surface lying against the as an impression for the esophagus and the larger impression for the stomach, right? So this I told you one thing before, that the caudate lobe and the quadrate lobe, these are anatomically the part of the right lobe, but functionally, it is a part of the left lobe. It means that the portal triad means these three structures of the hilum, which are going to, supply this left lobe, that is a bile duct and the hepatic artery in the portal vein, right? This portal triad basically, it is going to, the left portal triad is going to supply the left lobe along with the caudate lobe and the quadrate lobe. Is it clear? So remember that the caudate and the quadrate lobes, these are anatomically the part of right lobe, but functionally these are the part of the left lobe of the liver. Is it clear? Problem नहीं बचे. Okay. We will talk about this peritoneal relations. जी.
जो लेफ्ट लोब और राइट लोब होते हैं वो सिर्फ बाहर से ही सेपरेट होते हैं या अंदर से भी सेपरेट होते हैं इनके?
हाँ बेटे, मैंने आपसे यही बता रहा हूँ ना कि राइट एंड द लेफ्ट लोब्स इंटरनली दे आर सेपरेटेड. अभी जब when we talk about these segments, तो उसमें you will be having the detail कि वो किस तरह they're separate, because this line of fissure, ये जो है ना, the right sagittal fissure, right, this area, it is basically the demarcation line. इसके यहाँ से जब the portal triad is going to divide the right and the left, so this part, the part just right to this fissure, right sagittal fissure, this is functionally the right lobe, okay, and the part just left to this fissure, including the caudate lobe and the left lobe, that is, these are functionally the left lobe, okay. Because these lobes, the right lobe and the left lobes, these are supplied by the the portal triad, and this portal triad, they are going to divide, and these lobes, these are going to divide into the different segments, ठीक है. वो हम segments में पढ़ेंगे तो then you will see कि हर segment की अपनी blood supply है, उसकी अपनी portal vein उसको supply करेगी, उसकी अपनी artery जाएगी और उसके अपनी जो है ये bile duct होगी, right? So functionally every lobe, it is going to divide into the further 4 segments, 4 on the right side and 4 on the left side. ठीक है बेटे? And every lobe have its own blood supply, its own artery, own bile duct, and all own portal venous branch, so that if there is damage or some tumor occurs in this any part of the any segment of the any lobe, so we can resect that part and slough it off. We can get rid of. For example, if the tumor occurs in this part of the right lobe, so mostly we'll see that we'll mark the segment in which the tumor lies, and then we can go for this segment. We're just going to remove that segment, okay, without any damage to the other part of the liver. ठीक है, this is a protection from the nature. We'll talk about it in detail. ठीक है, is it clear, बच्चे?
Yes, sir.
Okay. So the peritoneal relationship. Say, बेटे peritoneal relations में we have got the first of all on the diaphragmatic surface we can have a look. और यहाँ पे जो सबसे पहले आपको एक peritoneal structure आता है. I told you before. Liver is what? It's an intraperitoneal structure that is covered from all of its surfaces are covered by the peritoneum. ठीक है जी? No, I told you before that there are certain locations at the viscerals, the peritoneum is thickened to form certain ligaments, right? Similar to the case happens in this, liver also. In the liver, you can see this on the anterior surface between the right and the left lobe. You can see this ligament, right? And this is called the falciform ligament. Falciform, which is a Latin word, it means a sickle shape. ठीक है, तो ये सिकल शेप लिगामेंट है जिसके ये एंटीरियर फ्री मार्जिन है, उसके इस मार्जिन में यू कैन सी अ लिगामेंट something that is called as a ligamentum teres. मैं बता चुका हूं कि ligamentum teres is remnant of किस चीज का remnant है जी? लेफ्ट ligament. चलिए चलिए now this two-layered fold of the peritoneum passes on the anterior surface. और दूसरा पट ये है कि this ligament, it is basically this falciform ligament, it is going to extend from the umbilicus to the liver, right? So it is going to going to attach the liver to the anterior abdominal wall. ठीक है जी? Okay, now this ligament, it passes on its anterior surface and then on its superior surface. ठीक है जी? How? When it will reach at near the under the diaphragm over here, it is going to split into the two layers, one on the right side and other one on the left side. ठीक है, ये double layer आ रही है ना? So when it will reach at the superior surface under the diaphragm, it is going to divide into the two layers here. One on the left side, which is going to form the right anterior upper layer of the ये जो आपको जो ligament नजर आ रहा है under the surface of the diaphragm, this is called the coronary ligament. ठीक है, अभी हम इसके बारे में डिटेल से बात करते हैं. This coronary ligament की जो anterior layer है, right, that is basically contributed by the the separation of this part of the falciform ligament. So the falciform ligament is going to split into two layers, one on the right, other on the left. The right one is going to form the anterior upper layer of the coronary ligament, ठीक है जी, superior layer or the anterior layer of the coronary ligament, and the other one, the left layer, is going to form the anterior upper layer of the left upper ligament नजर आ रहा है, you can say it's also an extension of the coronary ligament, which is going to form आगे जाकर is going to form the left triangular ligament. We'll talk about it in detail also, right? So this falciform ligament, it is going to divide into the right and the left one, and these right and the left, these are the anterior layers of the coronary ligament. ठीक है जी, प्रॉब्लम तो नहीं है जी? Okay, now what is the coronary ligament is then? The coronary ligament, which here you can see, this is the peritoneal reflection, which is going to hold the liver to the inferior surface of the diaphragm. ठीक है ना, ये वो ligament है जो कि posterior superior aspect of the you can see the posterior edge of the liver, say it's going towards the diaphragm, so it's going to